we're at the next phase where we can begin planning for a full return of our students. And I think if you've been paying attention to the news, you'll see that RHAM is not alone. That school districts across the state are either announcing return dates or they're beginning that process. And what we'd like to do is use our advisory committee, not to make the decision about when we're returning, but to help us put some context around it and make sure that we're addressing each of the areas that we need to address to make that decision. My intent is that we'll be able to announce next week a date for full return. What the administrative team needs to do is look at all of the pieces that we need to have in place for a successful and safe return, and make sure that we have the time to get all of those done. And the role of each of you is to help us so we can get feedback from you and get suggestions that you might have as well. So as the administrative team makes this decision, and then I'll certainly be consulting with the Board of Ed as we finalize our decision. The advisory committee is there to help us make sure that we're not missing anything. We've made this a public meeting so that members of the public certainly can share in what we're doing. We did open up an email address specifically to receive recommendations, and I'll talk a little bit about some of the emails we've received. We will have an opportunity for public comments. So anyone not on the committee will be able to add any suggestions that they may have as well. So with that, I'll ask those of you on the committee if you could introduce yourself, and I'll go down the list so that we're not all talking over each other. We have our two school nurses. Nancy?
Hi, Nancy Analek, high school nurse.
And Caitlin?
Caitlin Morse, middle school nurse.
Middle school teacher, Kim?
Kane, middle school math and REA rep and parent of a senior.
And Jillian?
Hi, Jillian Belanger. I'm physical education and health teacher and department coordinator.
And Greg?
Greg LaChance, high school math teacher and department coordinator.
And Nick?
Hi, Nick Kokas. I'm high school band director.
Great. Ethan? Okay, I'll come back to Ethan Spinelli. For our non-certified representatives, Natalie? I think actually she might be attending late. Stephen?
I'm here. I'm here.
Oh, Natalie, there you are.
I'm sorry. I was muted, of course. I'm Natalie Bradley. I'm a high school paraprofessional, and I'm also a co-president of the non-certified bargaining unit.
Great, thanks. Steve?
Steve Pizzato, high school special ed paraprofessional, UPSEU co-president.
Thank you. And Melissa?
Melissa Shellquist, administrative assistant to the middle school nurse and a parent of an 8th grader.
Great. And we have our parent members, Jenna Shell.
Hi, I'm Jenna Shell Oatman. I'm a parent of a current freshman and senior at RHAM.
And Kathy?
Hi, everybody. Kathy Scopus, veteran RHAM teacher and parent to a senior.
And Marcel? Not sure if she is. She may be late. And we have a number of students. Dana? I think Dana
is still in class.
Okay. So Lily, we'll go to you.
Hi, I'm the junior representative for the Board of Ed, and I'm also, a junior. So.
Great. And Amir?
I'm a RHAM inquiry middle school student.
Great. And who's our other, Teresa?
Hi, I'm Teresa Hooker. I'm a junior here at RHAM.
Great. And our Board of Ed rep, Kathleen.
Hi, everybody. Kathleen Goodwin, Vice Chair, RAM Board of Education, parent of an 8th grader and a 9th grader, and a fellow educator.
And our food service representative, Kate.
Good afternoon. I'm Kate Caselli, the General Manager of Whitson's Food Group.
And our business manager, Eva.
Hi, this is Eva Gallup, the business manager.
Director of Facilities, Michael.
Good evening, Mike Schlehofer, Director of Facilities.
Thanks. Our Director of Technology, Scott. Okay, Scott Butson's not here yet. And I know Dr. Briscoe was not able to make it this meeting, but I believe, Chris, you're sitting in for the high school.
Hi, everyone. Chris Mader, Assistant Principal.
And Michael, middle school.
Sorry, I was typing. Michael Cerusi, Principal to middle school.
And our special ed administrator, Christine.
Christine Hartwig, Director of Pupil Services.
And our athletic director, Dan.
Dean Trudeau, Athletic Director for the middle and high school.
And our SRO, Mark.
Yep, Mark Rivera, RAM SRO, parent of a senior, and I'm a Hebron Selectman, and I'm the liaison to RAM High School as a board member from the town of Hebron.
Great, thank you, Mark. Going to move to the Pledge of Allegiance. So I'll ask everyone to stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, with liberty and justice for all. Thank you. We're going to move to public comment. If anyone who's not on the committee would like to share any suggestions. The only thing is we would ask you to be brief, only because we have a limited time. We're hoping to keep the meeting under or to an hour. But certainly there'll be public comment at this point in the meeting, and there'll be some at the end of the meeting. So is there anyone from the public who would like to share a public comment or suggestions? Michelle, do you have your hand up?
Yeah. Hi, this is Michelle Crawford, and thank you everyone for meeting right now. I'm happy to see that the committee is reconvening. However, I'd like to see more parents on the committee. It's very administrator heavy. I realize there are some parents who are also administrators, but I think there needs to be more parent and potentially more student voices on this committee. Also, I may not make it to the end of the meeting due to my own work constraints, but I would really like to see RAM have more emphasis on what we can do to open. I've been listening to a lot of the Board of Education meetings, and it's why we cannot, which I find unacceptable. We need to be having our kids back in school, and I would highly encourage this committee to reach out to our peers in other similar school districts who are already moving forward with either they are open fully or are planning to open fully within the next few days or weeks. There's been a number of towns that have been mentioned, which include things like Ellington, South Windsor, Cromwell, Newington, Hartford Public Schools, and then locally our smaller friends like Hale Ray and East Hampton. I think it's time for us to open. So thank you, and I look forward to what this team can do.
Great, thank you, Michelle.
Yeah.
Any other comments or suggestions? Okay. Hearing none, what I'd like to do is I shared with the committee some notes to help us kind of move through the committee. And again, the purpose of this committee is to advise the administrative team as we work over the next few days to finish up our work on putting together a reopening plan for the district. And again, we will be announcing next week a date for a reopening date for the district. So let me, and again, I think, hopefully with inviting members of the public, we do get some more input as opposed to if we, had the meeting as a closed meeting. So let me start. I'm going to present my screen, and okay. So I'm going to start just by talking about what we're currently doing. And again, this isn't the final decision in any reopening, but this is, one of the, we've heard from a number of folks that both teachers and parents and students that if we could bring students back more often during the week as we move towards a full reopening, that would be beneficial. Hearing that, we looked at our schedule and looked at what can we do to make that happen. And so I'm sure many of you know we put a different schedule out at first that moved the days into different days of the week each week for students. And I think the universal feedback on that one was that it was just a little bit too scattered and was going to potentially create some confusion, and at a time when I think students need structure. So we went back and retooled it so that beginning this coming Monday, students will have the opportunity to attend school for 3 days a week. And if you're currently attending school on Monday and Tuesday next week, you'll continue to attend on Monday and Tuesday, but you'll also have Wednesday thrown in there as well. And then the Thursday and Friday students will have an opportunity on those other 2 weeks to attend for 3 days. I think if you look at most districts' full reopening plans, most of us are setting a date at some point in March. And I suspect that RHAM is going to do the same. So I don't see the schedule that I have it up on my screen as a 3 day a week, 2 day a week going for any longer than March. But at least beginning next week, we can start the process of getting students back into the building more frequently than just the 2 days. And I'll ask the committee, are there any questions about the schedule itself? Do any of our students have any questions about the schedule? I think we've kind of put it back and forth and shared it quite a bit. So we might have talked that one out. So, okay, let me go to the next screen. Just to provide some context and look at what the vaccine program has in store for us, and to talk about what other districts are doing. And again, these are all things that we want to at least consider. We may not choose to go with some of these routes, but we at least want to take a look and see what other districts are doing. In terms of the vaccine program, if you've been following the news, you've seen at least the fact that the governor announced a very different vaccine rollout than what was originally announced over the last couple of months. And in the new rollout, for most Connecticut residents, it's age-based at this point. So on Monday, those Connecticut residents 55 and older will have the opportunity to schedule a vaccination. For educators, and when I say educators, this includes teachers, paraprofessionals, bus drivers, food service workers, custodians. It really includes anybody who is working in a school with students. We will be the only unique group that will have its own schedule in moving forward. So we are scheduled to begin making vaccination or scheduling vaccination appointments beginning this coming Monday, March 1st. Each of the local health districts, and we are part of Chatham Health District. Chatham Health District serves East Hampton, Portland, Colchester, East Haddam, Marlborough, and Hebron. Andover is served by a different health district, but because RAM sits in Hebron, we are working with Chatham. And the directives that the health districts have been given is that they are to focus all of their vaccine clinics for educators during the month of March. So we, myself and the other superintendents in the Chatham Health District met last night, and we should know by the end of this week what the schedule of vaccine clinics within schools will look like. So we have uploaded the number of staff members that we have that will be eligible for vaccines. What the Chatham Health District is doing is they'll know on Friday what their the number of doses that they'll be able to receive. And so hopefully we will have a schedule by Friday and know when that's going to happen. The impact on school schedules is all of the superintendents within each of the health districts have offered our buildings as sites for the vaccination clinic so that we can more efficiently get our staff vaccinated. It's likely that RAM will be tied in with Marlborough and Hebron, so we may be the site for a vaccination clinic that will serve all three of our districts. And then we will likely be looking at having a remote day or two when the vaccination clinics occur. What Chatham Health is asking, we can go remote for the day of the clinic, and then possibly a day after for any side effects. That's what each of the schools will be doing. So we just need to find out if RAM is going to be first on the schedule, or possibly East Haddam or Colchester, and hopefully we'll know that by the end of the week so we can start moving forward with that. Any questions at all on the vaccination schedule? I know we shared some information with our teachers and staff members last night, so I think our staff is up to speed on how that's working.
Sure, Scott, I had one question about it. Is the school planning to adhere to the CDC guidelines based on vaccinations, being that they both Pfizer and Moderna recommend the 2 doses for 95 or whatever it is % efficacy, being that they are between 3 weeks and a month apart plus 2 weeks for that efficacy?
I guess I'm not sure Steve, what the question is.
The vaccine currently, the Pfizer and Moderna vaccines are both 2-dose vaccines.
Correct.
That are either 3 and 4 weeks apart. So are we planning on that sort of being the schedule for vaccines?
Yes. So we'll have a vaccine clinic scheduled, and again, that's going to be the first vaccine clinic will be scheduled sometime in March, obviously, hopefully earlier than later, and the second one would then be scheduled within that, whatever the, whether it's Moderna or Pfizer, whatever the time frame is. So each district will be scheduling 2 clinics at the appropriate distance apart. Is that the question, Steve?
Yep.
Yeah. Yep. Absolutely. So we'll be scheduling both the first and the second district vaccinations. Are there any other vaccination questions? So in terms of, looking at what other districts are doing, and we certainly are engaged with other districts on a regular basis. I meet with all of the districts on the eastern part of the state once a week. Our principals meet with schools from other parts of the state multiple times each month. So we are in constant contact with other districts and what other districts are doing. And quite frankly, right now, it is a bit all over the map. If you look close to home, East Hampton has announced their reopening on the 22nd of March. Coventry, to our east, has been open already for a while. Glastonbury right now has announced no plans for reopening, nor has Colchester, although I suspect that both of those districts are probably going to be moving towards a reopening sometime in April. Newington just announced that they'll be reopening, although their reopening is going to look different than I think other districts in that they're initially going back to a 4-day a week with keeping 1 day remote. Bristol just announced a return. They're doing a gradual phase in. So their seniors will return for a week, and then the next week an additional grade will return. So they'll be doing 1 or 2 grades each week until they have the full return. And then obviously some districts are setting just 1 day for a full return. So that's certainly one of the questions that our administrative team will be looking to in terms of what makes the most sense for RHAM. Is it a single date in which we're all returning, or is there some modification of that? And I think every district is really looking at their own situation to make that assessment. So, for example, Coventry and East Hampton being much smaller than RHAM, there are some things that they can do a lot easier. They don't have quite the numbers, and there are some things that aren't the challenge. Whereas, certainly Newington, which is a much bigger school, Bristol is a big school, they may be doing some things because of their numbers as well. Some of the interesting things that districts are doing as well is they're managing what students are actually able to return, and for those students that do return, how long they're able to remain out for. So for example, one of the districts, I believe it's Bristol, is only allowing those students who are currently attending in school to return. So if a student is currently remote, they're not included in the return model. I think Newington is requiring that families make a choice, and if you choose not to have your child return to school, then they're out for the rest of the year. They don't have another opportunity to return in. I think some schools are doing a similar type of thing, but in a smaller bites, so that if somebody chooses to be remote, they may need to wait until the next marking period before they can come back in. So there's some variation in terms of who schools are actually bringing back into the building, and how long they might need to wait before they're able to return to the building. I think most schools typically do allow students to go remote. It's just coming back that they might put some put some qualifications around. So with that, let me open it to the committee in terms of thoughts regarding looking at that full return, other schools that you might have be familiar with and what they're doing. But let me throw it out. The idea of a set date for a full return, a staggered return. Are there any thoughts on that?
Scott, is the health department offering any assistance in terms of, the risk mitigation strategies and bringing larger numbers together? I mean, are they stepping forward and saying a more gradual approach would make more sense rather than bringing everybody back next Thursday?
Kathy, I think that the health department is not giving advice that's that detailed. Instead, what they're suggesting is that based upon the relatively low positivity rates and based upon the fact that we have not seen substantial spread of COVID within schools, that it's safe to bring students back. So they're not going that far in suggesting that, you might want to think of a staggered return, anything like that. I think if we asked the director of health what their recommendation would be, I'm pretty sure they would say that a full return was probably as safe as a staggered return, as long as before we brought any students back in full return, we made sure that we addressed the mitigation efforts that we need to be watching for. So, if you might have seen the new CDC guidelines, which, basically focused on two things: wearing masks, which I think RHAM teachers and staff and students have excelled at. And the CDC references it as a 6-foot distance. If you look at the Connecticut reopening guidelines, the emphasis is on maximizing distance as much as possible. So we're not beholden to that 6-foot distance, but we are beholden to ensuring that we maximize the distance between students and staff as much as possible. So yeah, no, I don't think, Kathy, that they're certainly not making a blanket statement. I think that those districts that are looking at a staggered entrance or entry of students are probably doing so for a reason. And again, it may be that they're very large schools, and so they're looking at bringing them back, whereas other schools, may not see the issue of bringing everybody back at one time.
Okay.
Yeah.
Thank you.
Scott, this is Natalie.
Sure.
Will you be sending another survey out to parents?
Well, if you look ahead, one of the things one of the agenda items we have, Natalie, is to kind of look at what other information do we need to gather. So certainly one of the things I'm suggesting is that we may want to do, a survey of our parents. I can tell you from a planning standpoint, that's going to be helpful for us to know, if we, once we return, will the percentage of students that continue to attend school change? Will we see more students attending school? Will we see fewer? But we can talk about that a little more in a few minutes. That's one of the agenda items. Yeah.
I was going to bring something similar like that up. I think we definitely need to see how many students would continue to be in the building. And my personal opinion is, if we see that there's going to be a large drop-off, I don't see any reason to go to full if there's going to be less students actually in the building. And then I'm a little confused as to how we're going to actually distance all the students if we can't manage to properly distance during an 8-period day. I don't think administrators necessarily see the hallways during passing periods, but there is no distancing.
Mm-hmm.
In the atrium there might be, but in the actual hallways, like through the math and science pods and the English and social studies, there's not. I know it's enforced, but there really isn't. So I'm confused as to how we're going to manage to distance 1,000 students compared to what we're doing right now.
Right. And Dana, that is an excellent question. And I think that is probably the one question that I think keeps me awake at night. And again, to put some context around that. So what when you talk to the health directors, and again, I have the benefit of having weekly conversations with them, and that certainly has been, a hot topic for us in discussing what all of our plans should look like. And, obviously, RHAM has, and I know our parents probably haven't seen this, but RHAM is filled with one-way hallways, and we have arrows, and we have, we've divided as best we can to try to keep students, from coming in contact with one another. The kind of guideline that is still being used is close exposure to an individual who might be positive with COVID is measured as within 6 feet for, up to 15 minutes. And if you look at our schedule, and Dana will talk about the hallways, when over the summer, we built the block schedule partly to reduce the number of transitions between classes, because we knew that we weren't going to be able to always have 6 feet of distance between students during passing times. But by reducing the transition from one class to another, so going from 8 periods to 4 periods, it's allowed us to, at the very least, make sure that if students are closer to one another, it's not 8 times a day or 9 times a day. It's much fewer than that. I think from a distance standpoint, the biggest challenge that really vexes RAM is the issue that our schedule is fundamentally different than many other high schools, in that most high schools have a lunch periods that are staggered over the course of a period. And so it might be a 20-minute lunch period, like we used to do. We used to have a 5th period lunch, and the students would have 20 minutes, and then they'd have class, and then another group of students would have a 20-minute lunch. A few years ago, we went to scheduling all of our students for a full 45-minute period lunch. And we actually have a frequently asked question write-up for this that we'll be sharing with the community this week, because this has been a question that's come up. And so when we schedule our lunches, periods 5, 6, and 7, we have up to 4, and I'm just talking about the high school now, we have up to 400 students that are scheduled in the lunchroom. There is no way that we can adequately separate those students. Hence, our block schedule, which allows, we've put the lunch at the beginning of the day and at the end of the day, so students can arrive late, leave early. And what that has done for us is that it's significantly reduced that crowding in those areas. We have added the lunch period, a specific lunch period where students eat in smaller groups in their advisories. So, I think the block schedule, I think it does everything we can to minimize those large groups. I think, Dana, if we were looking at the really high numbers we were looking at earlier in the year, I agree with you. It'd be really tough to adequately keep that spacing. If the numbers continue to go down or remain low, we're certainly in a much better place to do that. The other thing that schools have going for them is we're fortunate that masks are such, people do such a great job of ensuring that they're always wearing a mask. So that helps a lot. And obviously, again, parents haven't seen this, but we certainly have enough hand sanitizer and wipes all over the place to, encourage and ensure that cleaning is constantly taking place. Those are definitely concerns for us, Dana. I think that's why, in terms of looking at a full reentry, we would be sticking with the block schedule so that we could continue those mitigation efforts to make sure that we minimize that crowding as much as possible.
I have a question.
Sure.
About the lunch block, especially at the middle school. The children can't leave. So for talking about advisory still being a lunch period, you're looking at 13 or more children in one classroom with masks off for a half hour. Has there been any thought of how to tweak that?
Well, again, that's a challenge. And I think one of the things we're going to have to be looking at over the next couple of weeks is, what can we do to make that area safer? Is it providing some dividers? Is it looking at, maybe switching some rooms out so that, some larger groups are in larger rooms? Someone mentioned the survey idea, and where I think that's going to be really important for administrators is that, if we have a better idea of how many people will we have in the building, it will help assist us in having a better idea of what are we looking at as far as large groups. Yeah.
Scott, I'm just wondering too, within that survey, if there should be something about are parents expecting students to still be 6 feet apart, or are they aware that the recommendations, that's one of the strategies, but that the recommendations have changed a little bit? And how comfortable are they with that? Although the advice may have changed, are teachers and parents aware, and are they comfortable with what that means in the school setting? Right. And I think that kind of related, Kathleen, to what you're saying and what Dana mentioned, is that I do think in our surveys, we're going to have to be very clear that, with a full return, we're not going to be able to guarantee, 6 feet apart. I think for some parents, they might answer a survey differently if we were talking about returning to the 8-period day, where we're much more crowded in the building versus the block schedule. So I think we're going to have to at least make sure that we're informing everybody of what we're looking at.
Scott?
Yep.
Yeah,
Hey, Mark.
from a public safety standpoint, I just want to throw out a bunch of ideas and see what people think.
Sure.
First of all, there's no such thing as a safe anything. There's managed risk. So being in public safety for 40 years, there's 3 things that contribute to making bad decisions and getting people in trouble. One is complacency. So we've been at this for a long time, and people don't want to hear that there's still risk. Number 2 is it'll never happen to me. And number 3 is not managing risk properly, because you just want something to happen regardless of the chances you're taking. So that's a concern to me. The young lady, Dana, who brought up distancing, spacing, large numbers of kids. I don't know what you're going to do with a bunch of kids in the lunchroom who are taking all their masks off at the same time to eat. That's a huge risk. If we go back full time, I can hardly handle the cars in front of the school now going on the hybrid with half of the school there. So they're already spilling out into the road. So now you're going to double that volume. So there's a risk in traffic and kids getting out of cars and all of that happening at the same time. And people seem to be backtracking on, let's open. We've already made that mistake 3 times and said we've opened prematurely several times. Sanjay Gupta and all leading officials have said that teachers should be essential workers and get vaccinated. But we backed off of that. And, since I'm in there with you guys every day, administrators, teachers, students, I have tremendous respect for everybody coming here and taking a risk and doing their job in such a dedicated manner. And to still get beat up by everybody by saying that they're still being apprehensive, they're not doing what's in the best interest of the community or kids, and that's nonsense. And I'm sick of hearing that. So I wanted to throw that out there. And I put my decision into my own family. My son is not going back. He hasn't gone back. He comes in for the lab, but he's doing just fine at home. And I'm not saying everybody is, but we need to address everybody, not just those individuals who push for one thing. There's 170 parents who don't send their kids to school right now. So if we go back full time and there's 170 doing a hybrid, which has been successful and been as risk-free as it can be, and I credit all of you for that, there's still risk here. This is not just, we're discussing it now. As a police officer, we have cops in town that have COVID right now. Troop K troopers have COVID. I lost my partner from the Hartford Police Department to COVID. Unless it hits you, you don't consider the dangers of what we confront. So I just wanted to throw all that out there to consider, because it doesn't seem like that has come up yet.
Okay, thanks, Mark. And Mark, I certainly couldn't agree with you more that managing risk is what we're doing. And I guess, I have to at least give a shout out to the folks at Chatham Health that are kind of helping us walk through this and helping us to better understand what managing risk might look like for us. So, and I think, Dana, you're probably the one piece that we're going to be most focused on in looking at a full return is how do we manage the large groups of students, I think, without a doubt. that's going to be the thing that we'll be spending most of our efforts in looking at. Other comments you'd like to share with us on?
I would.
Sure.
I just have a comment about these other options where students are not allowed to change their mind. Everything is rigid. How is it okay to say to a student, if you decide now you're staying out, you can't come back until June? I mean, is that something we want to? I mean, we should discuss that because it's this slide. But to me, that seems like unfair and something we can't really do since the environment's always changing. And I don't want students to like change on a daily basis or anything, but I don't think we can say you can't come back.
Yeah. And Greg, I would certainly concur with you that I think that there has to be some flexibility built into our schedule. I know that, in talking with different groups of teachers, one of the challenges is, students coming in and out, and that can be a challenge to manage. And I think that in a full reopening, that would be exacerbated, that challenge. So I do think there needs to be some, as we're looking at this, there needs to be some context or some limits in terms of how often or when you can come in and out. But I would concur that I think telling a student, if you're out, you're out, and you don't have an option to come back in is, because I look at the beginning of the year, one of the concerns we had that even reopening with a hybrid model, we were wondering what percentage of our students are actually going to enter the building. And quite frankly, we were up to as much as I think 30% of our students were choosing to remain remote. One of the pieces that the state kind of emphasized was the hope that schools would in fact be successful, and families that kept their students remote would see that success and feel more comfortable with having their students go back into the building. Certainly, I would hope that if we're looking at a increase in the number of students who are choosing to stay home, that the success of whatever we decide to do is such that they want to come back in. And I think we all know it's in the best interest of all of our students from an academic standpoint, from a mental health standpoint, to be in the building. And so I think telling a student you make a choice and you have to live with that for the rest of the year is a bit extreme. Are there any other thoughts on that particular issue?
Is that something that could, I'm sorry.
I was just going to say, I think, Greg, that's coming from schools that started off with that statement from the beginning. I know there's schools that basically said you're either coming in or you're not, and then they have teachers that are just all remote with those students. I'm not sure, but that might be where that's coming from. But yeah, I agree. If we're not already doing something like that, I don't think we should start doing that. Scott, is there an option? So would there be a scenario if we do put out the survey and more parents are then going to keep their students home? Would we still look to reopen, or would we just stay how we are if we're going to have less students in the building?
Jillian, I think we'd have to look and see what the data is to inform that. I can share what I think other districts have looked at, and that are kind of already moved in that direction, that they have found that although surveys sometimes show that fewer kids are showing up, that in some of those districts, actually more students than were in the survey showed up. That's not true across the board. And I think every community is a little different. Rocky Hill, for example, they had a full return and 60% of the students decided to stay home. So they only have 40% of the students. This was the last time we checked. But then again, you look at Ellington, and they're full in, and they have a very small percentage of students who are not attending. So, I think it's a piece of information we need to look at. And I'm not sure if that alone would tell us, oh, don't go in that direction, but it certainly would help inform how we do it and what we do. Steve, were you
Yeah.
Nope, Jillian actually asked my question.
Okay, great.
So Scott, maybe something like a 48-hour notice, if you're going to change, maybe something like that, because I do get that give and take, that sort of flip-flopping back and forth. I have a friend who teaches over at Mansfield Middle School, and they've experienced a lot of that where their kids, certain weeks they're deciding they're going to stay remote and then come back, the following Monday. And that makes things crazy. So maybe something like a 48-hour notice.
Right.
We just help everybody.
Yep.
Agreed. Things are very crazy. We need to have some sort of balance. I agree. But yeah, we can't just lock the door.
Can't stay. You say you got to be home for 3 months,
Yeah.
Yeah, I agree, Greg.
And I think actually in our conversations with like our department coordinators, I think that's the kind of what we've been hearing is that if we asked somebody to give, whether it's 48 hours notice or 3 days notice or something along those lines, it would at least help our teachers plan for, because who's in the classroom, it matters and it impacts how a teacher plans and what they're able to plan, whether it's a hands-on activity or whatever it might be. So that certainly is important. Okay. I'm going to move on to the next slide.
Before you do, I have a quick question.
Sure, Lily.
So I know that recent studies and Dr. Fauci has sort of announced that double masking provides higher or less risk for COVID. And I don't know if we would be able to sort of enforce that based on, it might be a sensitive subject for some people, but I think that if we were to go full, it would be a really important thing to bring up because it does reduce risk. And that's what we're looking for right now. And with more people wearing 2 masks instead of 1, the risk is, probably gonna, even though there's more people, the risk might be decreasing just because we're wearing 2 masks instead of 1. So I think in the whole plan of reopening fully, we should definitely address that.
Great. I think that's a great point. One of the things, and you're right, that may be a difficult thing to enforce, but it certainly is something we could encourage. We could, continually positive message on to do whatever we could to make that happen. We don't have unlimited resources, so it would be difficult to do this for everybody. But one of the things we are looking at is purchasing KN95 masks for all of the staff, so that they'll have access to masks that are proven to be much more effective than the typical cloth mask. But yeah, I think Lily, you're right that as much as we can do, if it's not a full out enforcement, as much as we can do to encourage that would certainly go a long way. And one of the things we keep on hearing is that if as you change things, you really need to double down on your mitigation efforts, and you need to make sure what you are doing or what you've been doing, you're doing better than before, and really be. Because I think, Mark, you mentioned how, we all get a bit complacent after a while, and things have been going so well, and it's easy to get complacent. We really haven't had any case. We haven't had to do contact tracing for the longest time. So, we've been very fortunate. That doesn't mean that it's still not a very serious, threat, and something that we need to be very careful and make sure that we're doing all we can to prevent any spread within the building. So I think that's a great comment.
One more quick question. It's not going to take long. Is this something that we are for sure it's happening? Are we at that point where we can say that our goal is to go back and full it within the next month?
Dana, I think we are at that point. And I say that because, one of the things that, and I'm pretty sure I might have said it to this group. I know I've said it to a number of groups,
I
back.
joined late, so I might have missed that. I was in a class.
I'm going back to the summer. So I think back in the summer, one of the things I mentioned was that we had to put our faith in somebody, because even in the summer, if you remember, the advice was all over the place. And, because, the state wasn't giving us clear, here's what you should do. Instead, it was all local control and you figure it out on your own. Because we were getting so much kind of sometimes contradictory information, I said, I think we need to put our faith in someone. And I put that faith, and I think it was rightfully done, in Russ, the director of Chatham Health, who has been spot on and has really been, really a godsend to help the district in our planning and make sure that we're doing everything right. And, when I ask Russ that question now, is there a reason not to be back full? At this point, the answer I get is no. At this point, it's safe to, as long as you're mindful and you are controlling those mitigation efforts, it's a safe move to make. And, I know that, I think we're all hearing that, because, we are seeing so many districts making that move now. I don't think it's out of impatience. I think that, they're hearing the same message, from their health districts. And I know, I mentioned Glastonbury and Colchester that, right now do not have any plans to return to full reopening. Having said that, in some of my conversations with them, I think we're going to see that change over April. And again, it's not necessarily just the pressure of, well, everybody else is doing it, so we should do it. But, they're also hearing that message that if you can manage the crowding, if you can manage the mask wearing and that sort of thing, we're at a point where it's safe to move in that direction.
Scott, the title that I heard this morning was Risk Mitigation Strategies, and I think that goes right in line with exactly what you were just saying.
Right.
And that's exactly where we are. We're going to move forward, continue to open, but the risk mitigation strategies are going to continue to be the key, and probably even more so now as we pull more people together.
Right.
So I thought that title was right on.
And I think people, we all need to understand too that, this could change on a dime. We have to be aware of that as well. That, this isn't none of our decisions have been hard and fast, regardless of what happens, we're doing this. So if we made this decision and announced that we're going to have a full return on X date, and the positivity rate spikes significantly, well then, we have to be mindful of that, and we have to be looking at that very carefully. If, I'm certain that schools that if they do return and they find that, they're all they're doing is quarantining students, and their cases within school are spiking dramatically, then that's going to lead you to rethink what it is you're doing. From a in school piece, when I say we haven't done any contact tracing, we really haven't had to do any contact tracing for it's really been weeks, and so that tells us that you could argue, well, the hybrid plan is working. I do think that things bode well for schools in that, because we can control things so well, we are in fact, probably a safer environment than a lot of other areas, outside of school walls.
But Scott, I think you're right in terms of watching the numbers. Even the spike that we saw yesterday, is that just a one-day spike, or are we going to continue to creep up now? Or was it just maybe we tested more? I don't know, whatever. It happened to be the fluke of the numbers. But hospitalizations were up yesterday too, along with the positivity just coming in just under 5. Now, what's that all about? Is that just, as I said, just a one-day thing, or are we, who knows?
Right. And that is something that we are certainly, painfully aware of and looking at the whole time.
Scott, one more question too, just listening to that. we're talking about going back in full and whatnot. And if we have to go out again, say the numbers spike and they continue to stay up, perhaps after April vacation, let's say people travel or whatnot. Is there a contingency to just stay out for a couple of weeks like we were before and then come back in full, or go back to hybrid because that seemed to be what was working based on the numbers? I think that's something that parents would want to know as well, because then they would have to make those arrangements that they're making now again.
Yeah.
If that were going to be the way to go.
And again, Steve, I think that obviously you have to look at each case, like where we are, but I think the advice would be, if we're full in and we're seeing a spike, the first option would be to go to the hybrid model. If it looks like it's sustainable. But again, that's assuming that we're looking at numbers that are working with our hybrid model. And that's assuming that we're looking at numbers in the building that we've been able to manage with our hybrid model. If we have a full out explosion of one of these variants, then that obviously would be a very different scenario that we haven't faced. And so you might be looking at, full remote. It just depends on where we are and what we're looking at. I think this is where I think our local health districts will be incredibly valuable, because they'll be able to hopefully cut us off at the pass and tell us, you should consider moving to hybrid because we're seeing numbers spiking. And rather than waiting until it gets to a certain number, let's prevent as much spread as we can, and we might be inclined to move to a hybrid model at that point. Versus an overnight huge spike, in which case, we might be out for a week or so. I think we need to be, be able to react to whatever's thrown our way.
Right. Yeah. And I just wanted to say, I think that, the parents ought to know that, like, if we're saying that, yes, we're going back full in a month or 6 weeks or whatever it is, that it's not a hard and fast, that this is what we're doing no matter what. But that based on what Chatham Health says, that we may end up going back to this eventually. Yeah, right.
I think we should all be prepared for whatever. And you're right. We're going to have to make it very clear that as we change our models, it's not necessarily a permanent change. It may be, or hopefully it is. And it's not just, for schools, we're such complex organizations. It's not just, we're sitting here talking about the opportunity to get students back full in for the academic piece of the thing. Dan Trudeau and the administrative team talk regularly about athletics and how can we ensure that remains successful and that students are safe, and that's working. Dr. Briscoe and I and Terrence Simon, one of the senior class officers, met with representatives from the Project Graduation Committee earlier this morning to look at, what might graduation look like, what might prom look like, what might senior outing look like, what might project. So, each one of those pieces is, we're talking about with different groups, but they really all contribute to the big whole. So, I think the administrative team is looking at everything and making decisions that we hope will contribute to the safety of everyone, regardless of what we're doing related to schools. Okay, I'm going to jump in, and I have to say, I think the vaccine piece was, in walking the halls today, it was really nice to see reason for hope and things to make a lot of people happy. So that was really wonderful that news came out. I think we were all really very pleased that decision was made to focus on educators for the month of March. Some of the things we've talked about, some of the things that the administrative team is looking at, and I think, we've already got some, Lily, you talked about emphasizing not only proper mask wearing, but looking at a double mask wearing and how can we encourage students to do that. We've talked about appropriate physical distancing. the period 5, 6, and 7 lunches, in particular at the high school level, but study halls, hallway passing time, classroom desk spacing, these are all things that we need to pay attention to, make sure that we have a reasonable plan before we, make any changes. Management of lunches and food distribution, that might sound like a fairly easy task, but Kate will certainly say that it's anything but easy. I had a conversation with Kate earlier today about what would it mean if we were back full time, because here again, we can't use our lunchroom to serve and have every student eat lunch during a particular lunch wave, because there's just going to be way too many students to make that safe. So right now, for those of you that aren't in the building, we have kiosks, lunch kiosks spread out around the buildings at both schools. And rather than going to the cafeteria, students are able to go to smaller gathering places to pick up their lunches. With more students in the building, that's certainly going to require more food and possibly more spaces. So we're talking about how can we expand those so that we don't end up with long lines of students, gathered around any of the lunch areas. And certainly the building and surface sanitation are both key. One of the areas that RHAM is very fortunate with is, a lot of districts struggle with having older buildings that have significant ventilation issues. We're fortunate in that we have a relatively new building, and we were able to put the new filters in that filter the COVID particles out of the air. So that is an area that we're very fortunate for. And most of our cleaning is ongoing in terms of cleaning surfaces and that sort of thing. Although we certainly understand now that this is really an airborne spread, we still have a lot of work being done to ensure that surfaces are clean, both as students come into the classrooms and before they leave the classrooms and in our public gathering areas. And I know we're going beyond our 2:30, so I'm just going to bring in one more slide. And in discussion of next steps, we talked about surveys. I'm assuming that what I'm hearing from people that you'd recommend that it would be valuable for us to survey our parents and students to see what choices people will make with a full return. We are looking at room and space operations. How do we manage classroom spaces? How do we manage public spaces? As Dana, you said earlier in the meeting, we're constantly rethinking how do we make sure that students move through the building most safely. And I think that's another area why we're kind of sticking with the block schedule at this point. Right now, we manage where students gather before and after school. We're going to have to look at that to make sure that those areas are adequately staffed and distance is maintained. Our communications to make sure that we're communicating effectively with everybody, both to staff and to our students and parents. In terms of return date, and for me, that the return date is based upon when can we safely make sure that we have put everything in place and we feel confident that we'll have all our mitigation efforts in place and sound, our staff in place and sound and able to effectively manage a reopening. And then obviously our next reopening advisory committee meeting. So I'll throw it out for comments. Again, a lot of those things we've already spoken about, but is there anything else that our committee members would like to share? in terms of encouraging us, things you'd like us to consider, things you'd like us to be looking at.
It'd be nice if we could schedule the return date after vaccination, at least after the everyone's significant number of teachers are vaccinated.
We were very, I mentioned earlier that the local health districts are going to schedule the vaccination clinics, which is really nice. And on Monday, our staff will also be uploaded into the vaccine management system, which is called VAMS. And, so if somebody wants to go out and get an appointment on their own, they're able to do that. We did find another workaround, and I don't know if any of our staff members here get a vaccine appointment yet?
Yes.
All right.
Yeah. A number of us did.
Yeah. So we were able to share Hartford. If your healthcare provider is a member of Hartford Healthcare, the portal opened up last night for them, and although they couldn't schedule a vaccination prior to March 1st, they were able to schedule vaccinations soon after. And so I know that I talked to a bunch of staff members last night and throughout today, and we were able to get a number of people scheduled as early as I think March 1st. I know there are a lot of people scheduled, I think March 8th and March 3rd. So, we were able to get a good portion of the staff in on those scheduling those. And that will certainly be earlier than anything that Chatham Health will be bringing to us. So, any other thoughts? Does this?
I was just going to say, Scott, I just think the parent survey is probably our next critical step, just so we can get a handle on numbers and, who would stay out, who thinks they would come back in. And so I think that would be our next critical step.
Okay. Yep. And does this time work for most everybody?
My only concern is that, are these technically public meetings?
They are, yes.
I'm assuming parents would probably be interested in this if we're talking about going back in full. So I'm not sure if that would be a reason to consider pushing it later into the day.
Well, you know what I was going to say, that's a good point, because we are getting a lot of emails from parents. And I know that Mr. Leslie and the board chair have spoken, and we are going to be doing meetings that will invite parents and have special parts of our Board of Education meetings specifically designated to communication to our parents. So just so you know, that's in the works.
Yep. We actually, we have a Board of Ed meeting scheduled for 7:30 we have two scheduled for Monday. We have a public forum for the budget, for any budget discussions, and at 6:30 on Monday, and on 7:30 on Monday, we'll have a review of kind of where we are with reopening plans and some student mental and social emotional programming that we'll be putting into place. So that'll happen Monday at 7:30. So what I'll do is I'll send out another invitation to the group then with some options for times later in the day, and we'll hopefully shoot for a day next week to make that happen. Is there anyone that's not a member of the committee that would like to add a public comment? Any suggestions? Yep, I see somebody with their hands up. Okay, it looks like the question was, if we went full back in, would it only be for 4 days? And right now, our thinking is that if we went full back in, it would be for 5 days. It would be that we'd use the block schedule, so we would just go the 1-2, alternate 1-2, 1-2, but students would be in the building for 5 days a week. I see a couple other hands. And Wednesdays would be full. That's correct. Yeah. Yeah, the schedule that starts on Monday really kind of eliminates that remote Wednesday that that we had.
Hi, Scott. It's Tammy Waddell.
Hi, Tammy.
I just am curious. In the beginning of this meeting, you said there was going to be an announcement next week of a plan to go back full. Is that still the plan? I mean, it sounds like the plan is to go back in full. I think if that's the plan, then when we go to survey the parents, it should be put that the plan is to go back in full. And we are going to have a date for that full date. We're working on how we make that happen.
Right, correct. Right.
Okay.
Hey, Scott, it's Ethan. It's Ethan. I just one point of clarification, just to make sure parents understand that a full day, you know, they might still think that's 210, a 210 dismissal. So I know there's probably some confusion around full return is still a 1255 dismissal.
Right. And we'll be sharing with parents a kind of a frequently asked question highlight on why that is. And again, that really is, you know, based upon, you know, some characteristics unique to the RHAM schedule and the necessity to manage the schedule so that we can keep, you know, students distanced. Yeah. Any other suggestions from any members of the public that aren't on the committee?
Hello, this is John Golan. I have a daughter who's currently going to RHAM High School. I guess I'd like to say that I do believe that the hybrid model has worked. It's kept us safe for throughout this terrible year. And there is a light at the end of the tunnel, obviously, with vaccinations coming. But of course, our student body will not be vaccinated before the end of June. And I do believe if the decision is made that we're going to violate the CDC guidelines for social distancing because the rules for Connecticut are more lax, we should say that. If that's the decision, then we need to be crystal clear that we cannot guarantee we will meet the CDC guidelines during lunch hours or other periods of the day.
Right. Thank you. Any other public comments?
I'm just gonna.
There's something in the chat if you want to look at that.
I was just gonna address that starting next Wednesday for all the middle and high school. It's a block schedule. So this day today, where it was 1 through 8, no more. It'll be the block schedule 1255. So whatever happens, correct me if I'm wrong, Scott, but that's the plan going forward.
Right. Correct. Yep.
Hi, this is Paula King. I just wanted to say thank you to the committee. I know this is a tough decision. Mr. Leslie, great explanation and going through things today. So I just wanted to say thank you and looking forward to just hearing when the next meeting is. I by chance stumbled across this and was glad I could get on today. And I'm hoping that you can share this with everybody, the parents, and through your newsletter so that we can all just kind of jump on and just listen, because transparency is really important during this time. So.
Yep. Great.
And I appreciate that these are hard decisions. So thank you to everybody.
Great. Thank you, Paul. Okay. Any other comments at all? So
just to throw out there, I do agree that we should probably publicize these more. I don't think it's intentional that we haven't. I think a lot of students would probably want to come to them. So maybe throwing something in like the weekly Rambler and sending it out to parents, I think that would be really well received.
Yep. Thanks. Okay. So we will send out a kind of a form for the committee members so we can schedule our next meeting. And then we'll release that and share it with the public when that is. Okay. So once again, I'm sorry. I know some of you had other meetings to go to, so I'm sorry if we held anyone up, but I appreciate everybody, our members of the committee. I can't believe how appreciative I am of all of your hard work in helping us to move forward. And for those of us that joined us, thank you for joining us. We really appreciate your efforts and concerns as well. Great.
And thank you to our amazing administrative team and all of our wonderful educators. Thank you all for working so hard every single day.
Great. Thank you, Kathy. Okay.
Yeah.
Good afternoon, everyone. Thanks again.